Welcome back to the channel. Today we're diving into a crucial topic that could save your life or the life of someone you love. We're talking about kidney health, specifically, the early signs of kidney damage. Now you might be thinking, kidneys? That's not exactly a glamorous topic, but trust me, this is important stuff. Your kidneys are like the silent guardians of your body, working tirelessly to filter your blood, remove waste products, and keep everything in balance. But here's the thing, kidney damage can be silent but deadly. It often doesn't show any symptoms until it's in the later stages. That's why it's absolutely crucial to recognize the early warning signs, so you can get the help you need before it's too late. So whether you're a health enthusiast or just looking out for yourself and your loved ones, stick around, because we're about to break down 5 early signs of kidney damage you absolutely must not ignore. Let's get to it. We call kidney disease a silent killer for a reason. You see, your kidneys are incredibly resilient organs. They can lose up to 90% of their function before you even experience any noticeable symptoms. That's why it's so important to be proactive about your kidney health. Don't wait until it's too late. Early detection is key to preventing further damage and potentially life-threatening complications. Think of it like this. You wouldn't wait until your car engine completely seizes up before taking it to a mechanic, right? You'd notice those strange noises, the warning lights on your dashboard, and get it checked out right away. The same goes for your kidneys. Paying attention to your body and recognizing the early warning signs can make all the difference. Now, I'm not telling you all this to scare you, but to empower you. Knowledge is power, and when it comes to your health, being informed can truly be life-saving. By understanding the early signs of kidney damage, you can take control of your health and seek medical attention promptly if needed. Remember, prevention is always better than cure. There are simple steps you can take to keep your kidneys healthy, like staying hydrated, eating a balanced diet, and managing underlying conditions like diabetes and high blood pressure. We'll delve deeper into these preventive measures later on, but for now, let's focus on those crucial early warning signs. Think of early signs of kidney damage as whispers from your body. They might be subtle, easy to dismiss, but they're trying to tell you something's not quite right. Ignoring these whispers can have serious consequences. As kidney damage progresses, you might experience more severe symptoms like nausea, vomiting, loss of appetite, and unexplained weight loss. In later stages, kidney failure can lead to the need for dialysis or even a kidney transplant. These are life-altering situations that can be avoided with early detection and treatment. So let's tune into our bodies and learn to recognize those whispers before they turn into screams. Remember, you are your own best advocate when it comes to your health. Don't be afraid to ask your doctor questions, get regular checkups, and advocate for yourself if you feel something isn't right. Early detection often means less invasive treatments, better outcomes, and a higher quality of life in the long run. Now that we understand the importance of recognizing those early signs, let's dive into the first one on our list, frequent urination. This seemingly innocent symptom can actually be a red flag for kidney trouble. Stay tuned as we explore why. Alright, let's talk about peeing, or more specifically, frequent urination. We all know that feeling of needing to go more often than usual, maybe after a few too many cups of coffee or on a chilly day. But when it comes to your kidneys, frequent urination, especially at night, can be a sign that something's off. You see, your kidneys are responsible for filtering waste products from your blood and producing urine. When your kidneys aren't functioning properly, they can't filter your blood as efficiently. This leads to a buildup of waste products and fluids in your body, which can trigger the urge to urinate more frequently, even during the night. Now I know what you're thinking. Dr. Mike, I pee a lot, but I also drink a lot of water. And you're right, staying hydrated is crucial for overall health, including your kidneys. But there's a difference between normal, healthy urination and frequent urination that's a cause for concern. If you find yourself constantly running to the bathroom, especially at night, and it's not related to your fluid intake or medications, it's worth bringing up with your doctor. They can help determine if your frequent urination is a harmless annoyance or a sign of an underlying issue, like kidney damage. Now, before you panic and self-diagnose with kidney failure just because you've been hitting the bathroom a bit more often, it's important to remember that frequent urination can be caused by a variety of factors. Urinary tract infections, diabetes, prostate problems, and even certain medications can all lead to increased urination. That's why it's crucial to see your doctor for a proper diagnosis. They can run tests to pinpoint the root cause of your frequent urination and recommend the appropriate treatment. The bottom line is this. While frequent urination doesn't always mean you have kidney damage, it's a symptom that shouldn't be ignored. If you're experiencing any changes in your urinary habits, especially if accompanied by other symptoms like pain or burning during urination, blood in your urine, or back pain, don't hesitate to reach out to your healthcare provider. Early detection and treatment are key to preventing further complications and maintaining your kidney health. Alright, let's talk about a symptom that can be pretty alarming: blood in your urine, also known as hematuria. Now, before you panic, it's essential to understand that not all instances of blood in the urine indicate kidney problems. It could be something as simple as a urinary tract infection, which is easily treatable. However, if you do notice blood in your urine, even if it's just a tinge of pink or brown, it's crucial to get it checked out by a healthcare professional. Don't ignore it. We need to rule out any serious conditions. Remember, early detection is key when it comes to kidney health. The sooner we catch any potential issues, the better the outcome. So, if you're seeing red or even a little pink, don't hesitate to schedule that doctor's appointment. There are several reasons why you might find blood in your urine. As we discussed, urinary tract infections are a common culprit. These infections can irritate the urinary tract, leading to traces of blood. Another possibility is kidney stones. These hard deposits can form in the kidneys and may cause bleeding as they pass through the urinary tract. Kidney stones can be incredibly painful, so blood in the urine accompanied by severe pain could be a sign. In some cases, blood in the urine can be a sign of a more serious underlying condition, such as kidney disease, inflammation in the kidneys, or even certain types of cancer. That's why it's so important not to self-diagnose. If you notice blood in your urine, consult with a healthcare professional to determine the cause and receive appropriate treatment. While seeing blood in your urine can be frightening, it's important to remember that not all cases are emergencies. However, there are certain situations where you should seek immediate medical attention. If you experience blood in your urine along with severe pain in your back or side, fever, chills, or vomiting, it could indicate a serious infection or kidney stone. Additionally, if you notice a large amount of blood in your urine or if it's accompanied by clots, you should head to the emergency room right away. These could be signs of a more significant problem that requires immediate care. Remember, it's always better to err on the side of caution when it comes to your health. I know we covered a lot about a potentially scary symptom, but remember, knowledge is power. Now you know that blood in the urine can be a sign of a kidney issue, but it can also be caused by many other things. The most important thing is to listen to your body and seek medical advice if you notice anything unusual. Don't panic, but don't ignore it either. Early detection and treatment are essential for maintaining good kidney health. Alright, let's talk about fatigue. It's something we all experience at some point in our lives. We all feel tired sometimes, right? Whether it's from a long day at work, a strenuous workout, or just the hustle and bustle of daily life. Especially after a long day or a tough workout, it's normal to feel worn out and in need of rest. But when you're experiencing persistent fatigue, the kind that just doesn't seem to go away no matter how much sleep you get, it might be a sign that something else is going on. This kind of fatigue can be more than just tiredness. It can be a signal from your body. Now, you might not immediately think of your kidneys when you think about energy levels. Most people associate kidneys with filtering waste, but there's more to it. But the truth is, these bean-shaped organs play a crucial role in keeping your body energized. They are essential for maintaining overall health and vitality. One of their main jobs is to filter waste products from your blood. This process is vital for keeping your internal environment clean and balanced. And when your kidneys aren't functioning properly, toxins can build up in your system. This accumulation of waste can have a significant impact on how you feel. This can lead to feelings of exhaustion and weakness. You might find it hard to get through the day without feeling completely drained. Think of it like this. Imagine your body is like a car, and your kidneys are the oil filter. Just as a car needs a clean oil filter to run smoothly, your body needs well-functioning kidneys to stay energized. When the oil filter is dirty and clogged, the engine can't run as smoothly. It struggles, and so does your body when your kidneys aren't working properly. It's the same with your body. When your kidneys aren't filtering waste efficiently, your body has to work harder, and you feel that fatigue. This extra effort can leave you feeling constantly tired and out of energy. So if you're constantly feeling drained, even after a good night's sleep, it's important to pay attention to your body and consider whether your kidneys might be trying to tell you something. Don't ignore these signs, they could be crucial for your health. Another way kidney problems can lead to fatigue is through a condition called anemia. Now, anemia is a condition where your body doesn't have enough healthy red blood cells to carry oxygen to your tissues. And guess what? Your kidneys play a role in producing a hormone called erythropoietin, or EPO for short. EPO is basically like a signal that tells your bone marrow, the factory inside your bones that produces blood cells, to make more red blood cells. When your kidneys aren't working properly, they might not produce enough EPO. This can lead to anemia, which leaves you feeling tired and weak. It's like a domino effect. Kidney damage leads to lower EPO levels, which leads to fewer red blood cells, which ultimately leads to fatigue and low energy. So, if you're noticing that you're more tired than usual, and you're also experiencing other symptoms like shortness of breath, pale skin, dizziness, or cold hands and feet, it's important to see your doctor. Now, it's important to remember that fatigue is a very common symptom, and it can be caused by a whole bunch of different things, not just kidney problems. So before you start jumping to conclusions, it's important to consider other potential culprits. Stress is a big one. When you're constantly stressed out, your body goes into overdrive, producing hormones like adrenaline and cortisol. This can leave you feeling drained and exhausted, even if you're not physically exerting yourself. Lack of sleep is another obvious one. When you don't get enough shut-eye, your body doesn't have time to repair and recharge, leaving you feeling sluggish the next day. And then, there are medical conditions like thyroid disorders, heart disease, and even depression, all of which can contribute to fatigue. So, when is it time to see your doctor about fatigue? Fatigue can be a common issue, but there are certain signs that indicate it might be more serious. Well, if you're experiencing any of the following, it's definitely a good idea to schedule an appointment. Don't wait too long to address these symptoms. First, if your fatigue is severe and persistent, meaning it lasts for more than 2 weeks and doesn't seem to improve with rest, it's time to get checked out. Chronic fatigue can be a sign of underlying health issues. Second, if your fatigue is accompanied by other unexplained symptoms, especially those we've talked about earlier like changes in urination, blood in your urine, or unusual abdominal pain, or swelling in your ankles and feet, it's crucial to seek medical attention. These symptoms can indicate serious conditions that need prompt evaluation. Third, if your fatigue is interfering with your daily life, making it difficult to work, concentrate, or perform everyday tasks, or participate in activities you normally enjoy, don't hesitate to reach out to your healthcare provider. Your quality of life is important, and persistent fatigue shouldn't be ignored. And lastly, if you have any concerns or questions about your health, it's always best to err on the side of caution and consult with a medical professional. They can provide guidance and peace of mind. Remember, you know your body best. Trust your instincts when it comes to your health. If something feels off, don't ignore it. Early intervention can make a significant difference. Early detection and treatment are key, especially when it comes to your kidneys. Taking action now can help prevent more serious issues down the line. Ever notice your ankles or feet looking a little puffy, especially after a long day? This can be more than just a minor inconvenience. Well, that swelling, also known as edema, can actually be a sign of kidney trouble. Edema occurs when excess fluid gets trapped in your body's tissues. You see, healthy kidneys play a crucial role in regulating fluid balance in your body. They ensure that the right amount of fluid is retained while the excess is expelled. They act like a filtration system, removing excess fluid and waste products from your blood. This process is vital for maintaining overall health. But when your kidneys aren't functioning properly, they can't remove excess fluid as efficiently. This inefficiency can lead to various health issues. This can lead to a buildup of fluid in your body, particularly in your extremities like your ankles, feet, and even your legs. The swelling can become quite noticeable and uncomfortable. Think of it like this. Imagine your circulatory system is like a network of pipes and your kidneys are like a drainage system. They work together to keep everything flowing smoothly. When the drainage system is clogged, water can back up and cause flooding. Similarly, when the kidneys are not working efficiently, fluid can accumulate. Similarly, when your kidneys aren't working properly, fluid can build up in your tissues, causing swelling. This swelling is often a visible sign of underlying issues. Now, it's important to note that swelling in your ankles and feet can be caused by a variety of factors, including standing for long periods, pregnancy, and certain medications. These are common and often temporary causes. However, if the swelling is persistent, severe, or accompanied by other symptoms like fatigue, changes in urination, or foamy urine, it's essential to see your doctor to rule out any underlying kidney problems. Early detection can make a significant difference in treatment and management. Now let's dive a little deeper into how kidney damage can actually lead to swelling. As I mentioned earlier, healthy kidneys filter waste products and excess fluid from your blood. This process is driven by a delicate balance of proteins in your blood, particularly a protein called albumin. Albumin acts like a sponge, helping to keep fluid within your blood vessels. However, when your kidneys are damaged, they can leak albumin into your urine. This loss of albumin disrupts the fluid balance in your body, causing fluid to leak out of your blood vessels and into surrounding tissues, leading to swelling. Furthermore, kidney damage can also impair the production of a hormone called aldosterone. Aldosterone helps regulate salt and water balance in your body. When your kidneys aren't producing enough aldosterone, your body retains more salt and water, further contributing to swelling. So, it's a combination of factors: loss of albumin, impaired aldosterone production, and reduced fluid filtration, that ultimately contribute to swelling in the context of kidney damage. Now, before you panic about every swollen ankle, it's important to remember that edema can be caused by a number of things besides kidney problems. So, let's talk about some other common culprits. One of the most common causes is simply gravity. When you stand or sit for long periods, gravity pulls fluid down into your lower extremities, causing them to swell. This is especially true if you're not moving around much, as muscle contractions help to pump fluid back up towards your heart. Pregnancy is another common cause of edema, particularly in the later stages. As the uterus expands, it can compress veins in the legs, making it harder for blood to return to the heart. This can lead to fluid buildup in the legs and feet. Certain medications, such as corticosteroids and some blood pressure medications, can also cause fluid retention and swelling. And then there are other medical conditions like heart failure, liver disease, and venous insufficiency, which can also contribute to edema. So, when should you be concerned about swelling in your ankles and feet? Well, it's always a good idea to err on the side of caution and see your doctor if you notice any of the following. First, if the swelling is sudden or severe, don't wait to get it checked out. Second, if the swelling is accompanied by other symptoms, especially those we've talked about earlier like fatigue, changes in urination, shortness of breath, or chest pain, it's crucial to seek medical attention immediately. Third, if the swelling doesn't improve with home remedies like elevating your legs or reducing salt intake, it's time to see your doctor. And lastly, if you have any concerns or questions about your health, it's always best to consult with a medical professional. Remember, early detection and treatment are key, especially when it comes to your kidneys, so don't ignore the signs. So there you have it, guys. We've covered 5 early signs of kidney damage that you absolutely shouldn't ignore. From changes in your bathroom habits to persistent fatigue and swelling, these seemingly small signs can be your body's way of telling you that something's not quite right. Remember, your kidneys are incredibly important organs, working tirelessly behind the scenes to keep your body healthy and functioning properly. Ignoring these early warning signs is like ignoring a flashing check engine light in your car. It might seem like a minor inconvenience at first, but it could lead to much bigger problems down the road. If you notice any of these signs, don't ignore them. Consult a healthcare professional immediately. Early detection and treatment can make a world of difference in preventing further damage and preserving your kidney health. Thanks for watching.